My name is Joel Garris. With me this week is Rob Field. You're listening to Dollars and Cents. On this segment, we're going to talk a little bit, Rob, about there's a lot of myths when it comes to Medicare. We run into this, boy, I mean, if not every day, certainly every couple of days where there's just this misconception on some of the things that that you can have that are normal with Medicare. And Rob, as our sort of resident National Social Security advisor at Nelson Financial Planning, you kind of help us tackle these issues for clients on a regular basis.
Right. It's becoming a growing conversation. I think people, Social Security is in the news, and so we get more and more people asking about it. And when I studied and became certified in it, I knew the basics, but it just continues to grow, and the questions get deeper and deeper. And then the same website that's you're using for Social Security is also the same place you go for Medicare. And at some point, your Medicare premium may be coming out of your Social Security payment. So we've just spent more and more time trying to keep up with it, and it changes. Every year the rules change. There's plenty of mention of it in the news. So, I try to keep up with the best I can. As you've mentioned before, we're not selling medical insurance, but we certainly can advise and help coordinate. First of all, the big difference between Social Security is money's coming to you, and you can start at 62, wait till age 70. But with Medicare, it's kind of a little more black and white. It's at age 65 is when it starts, and depending on your job and things like that, it determines whether you got to start right then and there. And then once you decide to start, then you got to see what all your options are and what's best for you. And so we hope to kind of tackle some of that today.
Sure. And to that point, I mean, there's some real consequences. I mean, with Social Security, you get a range, right? You can take it starting at 62, as late as 70. Okay, fine. If you miss it by a few months, well, you're going to get a little bit more money. So no big deal. With Medicare, though, you've really got that age. And so that's where a lot of these conversations kind of get into is sort of that general, some good solid general advice regarding Medicare, and of course with open enrollment starting in like 30 days from now on October 15th, and appropriately enough, good topic for today's show.
Right. I mean, the process of signing up for Medicare, it's a lot more rigid than if you're signing up for Social Security. And as you mentioned, if you decide, I'm going to wait a while on Social Security, there's no penalty by waiting. Social Security would be happy for you to delay taking their money. But on Medicare, it's the opposite. There's things and consequences you want to be aware of on those deadlines. Since we know that Medicare, it's going to play, it's going to affect 70 million Americans or more. So that's a lot of people who need to really be paying attention to what their options are and make sure they don't miss any penalties. And we got a lot of misinformation going around. It's one of the reasons that we talk a lot about this is that we'll have clients and prospects come in and they'll say, well, I heard this podcast and they said this. My neighbor told me this, and I read an article and it said this. And they're not the same across the board. And anybody can make up what they think is correct. And so we're trying to avoid the myths that are floating around.
Well, and I think that's the key part of it is, look, there's multiple layers to this onion, and I think that's sort of where the confusion begins. So, Rob, help us break down sort of just Medicare 101, the different parts that exist out there.
Right. I mean, so the first confusion that people always have is that, Medicare is free. They think, okay, Part A may be, but the other parts are not. So you need to understand that there is a cost built in at some point. Part A covers hospitalization, and it's not that it's free, but that's what you've been paying for throughout all the years you work, you or your spouse, and as long as you've been doing that for 10 years or longer, then when it comes time and you turn age 65, you will then qualify for Medicare Part A. You'll get your Medicare card, and there'll be no additional cost for that. But you do have to have the doctor services, which is referred to as Part B. You've got to have that in some form or fashion. It's either going to be something that if you have it through work, that's fine until you're not working. Then you got to jump on the bandwagon and get Part B through Medicare. It's about $185 a month. That's the base that covers doctors. But regular Medicare, it's an 80-20 split. So now you got to think about, well, I got 20% of my costs. If they're high, how am I going to sort of offset that? That's where the Medicare supplements come in. Those can be $200, $300 a month more above the $185. And then there's another myth about Medicare that that all you need is just regular Medicare, which that's A, and then yes, you could pay for the B, but then you'd have that Medigap that's in between, and then you haven't addressed the hearing, the vision, and the dental. So, on Part B, you want to keep in mind that it's 185, could be higher, also based on your income. Right. Then there's Part D, and this is kind of the new one that popped around in 2003. It's the voluntary prescription drug plan that you can get. So, prescription drugs are sometimes the largest cost of medical expenses that people have, so you need to be able to address that at some point or another. That's going to be another $47. So these numbers start adding up.
They do.
Medicare is definitely not free.
If I'm adding these numbers in my head, Rob, you're talking about $500 roughly per person for those premium amounts. So retired couple, it's probably close to $1,000. And I think you mentioned this a little bit, but I want to further outline it. The income adjustment that can happen, IRMAA, the income adjustment that can happen that increases your cost of Medicare. If you're above certain income thresholds, you ain't going to pay $185 for your Medicare Part B. You're going to pay, maybe it's $230, maybe it's $300. In some cases, it's $400 or $500, depending upon what your income is.
Correct. That's that income-related monthly adjustment amount that has been popping up because people are like, well, wait a second, they're charging me a whole lot more than $185. What they're doing is they're saying, okay, single person around $100,000, a married couple $200,000. If you're above that, they're going to bump up that $185. And what also throws people for a loop is that they're looking at what you made a couple of years back.
Yeah. That's always the confusing part. Yeah.
And
it's not what you're making now.
Right.
Like for 2026, when you get the letter in January, they're going to be looking at 24 tax return.
Right. So you get a lot of people, they retired this year, and they're like, this year I'm not making very much money, and yet I'm having an income-related monthly adjustment amount applied to my Part B. You can fight it, but that's just the rule. They go back 2 years.
Right.
Give it a couple of years, it'll fall off.
There is a form, though, I think it's SS44, that you can file, that you can say, hey, wait a minute, I retired, and clients have been having a little bit more success of late at fighting that IRMAA adjustment than, say, for example, 3 or 4 years ago. 3 or 4 years ago, no one ever kind of won on that one. But we've seen where so it's worth doing if you find yourself in that position.
Right. It's just a standard form. We can help you find it. You fill it out. You give your reason. You turn it in. We've had some people who've had some success.
Right. So we talked about A and B and D. Well, there's a C as well, isn't there, thrown in there?
Correct. A is hospital, B is doctor, D is prescription drugs. Or if you look at the Medicare Advantage side, where you're going to now take kind of an outside carrier, they call that Part C. And Part C is actually A plus B plus D all combined. And then your 185 is then channeled to the carrier that's giving you the Medicare Advantage plan. And sometimes you get some other bells and whistles that you would not or could not get through a traditional Medicare plan or Medicare supplement plan.
But the difference with Medicare Advantage is that serves really as more, and I always get confused, PPO, HMO. It's the gatekeeper version of that.
Correct. Right. The thing that everybody likes about Medicare is that everybody takes it. You just walk into the doctor. I've got a hurt foot. Oh, I've got a neck ache. Oh, I've got a stomach problem. You just show them your Medicare card, away you go. On Medicare Advantage, you do have the PPO or HMO setup where you have a primary care physician. You go to him first or her first. They make a referral to somebody. But it's not bad because, all the doctors are coordinated amongst themselves. I'm a fan of it. We'll talk about that in a little bit. But it's two different things, and it's a personal decision.
So I guess that's myth one debunked is Medicare ain't free.
Right. Medicare does cost money.
It does cost money. So let's dig a little bit into the timing of enrollment because that's pretty important.
Right. So we've got there are different definitions of enrollment periods. The first one we're going to look at is just your initial enrollment period. And this it's a 7-month window. It starts 3 months before your birthday, the month of your birthday, 3 months after, and then that's at age 65. It's all built around that. And then enrolling that is important because if you don't have coverage through work, you do need to get that Part B right away.
Otherwise, there's some fine print on that, and we're going to get into that fine print after these messages. So stay tuned with us here on Dollars and Cents with Joel Garris, Rob Field of Nelson Financial Planning.